So there is a general examination and systemic examination. Now, what general examination? Where you examine whole body, not related to particular system. So general examination में points आते हैं. First, you will take a temperature. Even if patient doesn't have fever, so it is normal criteria. अभी practice में usually we don't waste time. So we just touch by the finger, and if we see it is not fever, then we will mention it is afebrile. Or if you feel you touch and you feel there is increase in temperature, then you put thermometer and you will mention the what is exactly its body temperature. So you will maintain temperature. If temperature is normal, then you will mention it as afebrile. Febrile means fever. Afebrile means absence of the fever. Then you take a pulse. Then you mention the pulse rate and details about the pulse rate. उसके लिए हम अगर मौका मिला तो we can have a separate class how to examine the pulse and all those things. Then you take a blood pressure. In that blood pressure also you will record it and you will mention compulsory. Every patient you will record blood pressure because blood pressure is a disease which doesn't show symptoms early, but you can diagnose it early just by simple checking blood pressure. So you'll take, and many times fever is also related to blood pressure. If suppose someone has a high grade fever with a low BP, then it is a very risky case. So patient might have multiple organ failures or there might be a cases of septicemia. So recording blood pressure is very important. After that, you will check a respiratory rate. Suppose patient is complaining of cough and cold, and if you miss the respiratory rate and he might have breathlessness, but patient is not conscious level, उसको सिर्फ खांसी लग रही है. So if respiratory increase means he has some difficulty in respiration. That's why his respiratory rate is increased. So all those things you mentioned, these come under general examinations, or also these come under vital signs. Patients के survival के लिए जो important है, this wise. Pulse नहीं होगा तो patient मर गया, temperature कम है तो patient मर गया, blood pressure record नहीं कर रहे तो patient मर गया, respiratory rate नहीं है तो patient मर गया. So these are vital signs. So this can give you idea about whether patient is critical or not. After that, you will examine for the other signs like pallor, anemia है कि नहीं, वो eyes के नीचे tip of the fingers पे, tongue पे आप देख सकते हो. नॉर्मली पिंकिश कलर आइज दिखती है, पिंकिश कलर टंग होती है. अगर उस एनीमिया होगा तो दैट विल लुक मोर वाइटिश. तो हमने शायद आरबीसी में भी उसके बारे में बात की थी. तो पेलर प्रेजेंट है क्या, देन येलोइश डिस्कलरेशन है क्या स्किन पे, दैट इज कॉल्ड इक्टेरस और जॉन्डिस. देन ब्लूइश डिस्कलरेशन है क्या स्किन का, दैट इज एग्जांपल ऑफ साइनोसिस. देन फीट पे एडिम स्वेलिंग है क्या कि बॉडी पे कहीं पे फीट पे, दैट comes under edema feet. Then we'll talk about whether lymph nodes है क्या बॉडी पे, कहीं पे swelling है क्या, multiple small swellings, all those things. We see overall appearance of his body, कि whether he look toxic or his look normal. We'll also mention about his consciousness, whether the patient is alert है आ रहा है क्या, sometimes patient is very drowsy, उसको हिला हिला के सवाल पूछना पड़ रहा है. So we'll talk about the consciousness also. These all come under a general examination. Then you go for a systemic examination. Now in systemic examination, we examine under 4 reading: respiratory system, cardiovascular system, per abdominal. Per abdominal we don't discriminate. Here we discriminate GI system and urogenital, but in India we'll consider the per abdominal whole. Excretory system, GI system, liver, spleen, everything we'll consider as a one part. So we'll take a per abdominal examination. And last is a central nervous system examination. So here we'll not do all examination. Here we'll do detailed examination of the system of our concern. जब आप history लेते हो, history में आपको कौन सी system involved है उसका थोड़ा बहुत idea हो जाता है. And once you do general examination, suppose patient having a cough, cold and fever, so it gives idea that the respiratory system is involved. And so if you do in general examination, if his respiratory rate is a little bit high, then it's definitely respiratory system is involved. So you'll go in detailed examination of respiratory system. But suppose same thing, a patient of pulse, fever, cough, and if you do in general examination, you'll see there is a severe anemia, there is increased heart rate, so there might be a cardiovascular system is also involved. So here you will do respiratory system also in detail, and cardiovascular system is also detail. And other systems you will just do overall look whether if there is some abnormality or not, that superficially will examine. These all come under clinical skill. Now, professional skills, it is a way you present yourself, how you wear the dress, how your clinic has been set up, how you talk to the patient, your mannerisms, like taking consent. Suppose you are a male doctor and there is a female patient is coming, then you should voluntarily ask for consent. If there is a one form of implant consent, once Patient coming to your clinic means he has already given you consent. You can examine me. But still, if the patient is female, then we should ask oral consent. That is called informed consent. Okay, I want to examine you, and can I examine you? And then patient say yes, then only you can examine. And that time also you maintain your ethics. If you are examining a female patient, being a male doctor, there has to be one female attendant. So it can be your nurse or it can be any other, even sweeper also or anything, but it should be female, or it can be a patient's relative, patient की sister, patient की mother, patient की daughter, कोई भी हो सकता है. But there should be another female should be present, and then only you can examine to the female patient. So these are like a professional skill, how uh, you execute all your clinical skills without hampering their moral responsibility or social responsibilities and their personal rights. Usko, without compromising. And another most important part of our professional skill is professional secrecy. So what is information? Normally nowadays I see many of my students, they are now interns or uske baad, and whatever they are doing, performing any activity, they're very excited. कि मैंने delivery की है, मैंने first time I'm doing this procedure and all those things. They click the picture of the patient and they post on the social media. But it's very wrong. If any patient knows about this, it's very wrong, they can sue you on the court and you have to pay compensation because you could not keep their professional secrecy. So there is a clause of professional secrecy when you're taking oath being a doctor, that I will keep all information of my patient secret unless and until it is in benefit of the patient, then only I will reveal those information. So that is also comes under professional skill. समझ में आया?
Yes, sir.
और कुछ पूछना है?
No, sir, thank you.
Minas, you can read South Asia edition guidance, and that is only available in India. Oves, sorry. बोलिए क्या पूछना है आपको? Oves? Yes, Oves. ओके, और कुछ किसी को पूछना है? मैं पानी पी के आता हूँ, 2 मिनट का ब्रेक लेते हैं. सो एक्चुअली हमारा अभी हेमेटोलॉजी पूरा फिनिश हो गया है. So what we should start? Okay. Now for that only, what I said, you need to keep on reading it. It is definitely there are huge syllabus, and you tend to forget all those things. So never try to remember things. कि RBC का ये shape होता है, RBC का वो shape होता है. If you remember why RBC is biconchave shape, you will never forget RBC shape is biconchave. So don't try to remember. Try to understand why it is so. Then only you will not remember things. And second thing, you need to keep on read it repeatedly. एक बार पढ़ के नहीं होगा. It is not like your 11th or 12th study. The MBBS is very different than your 11th, 12th study. 11th, 12th study, you have a syllabus something like here. And compared to this, MBBS syllabus is huge. And it is very difficult to remember or try to memorize everything. So the best part to study MBBS is try to understand those things. If you understand, you'll never forget those things. Same questions. Indu Khurana, AK Jain, Gaitan. Okay. This GK Paul also you can use, but don't use Sambulingam. Okay. Sambulingam तो किसी दिन मेरे पे केस करने वाला है. Because this recording also goes on YouTube, and in many YouTube channels I said don't read Sambulingam. Uh, Please, can someone tell me? Okay, 1 minute. Did we? Did I taught you skeletal muscle? I guess those are from ISM. उनका मैं skeletal muscle कर दिया है. Okay, so should we start this topic? Nerve muscle physiology. Okay. Okay, then we'll start with the structure of neurons. So now we have started with our competency, third competency, and in the third it is a 3.1 competency. Okay, we start with the structure of neuron, then like a type, functional properties of the nerve fibers, and if you get a time, then we'll talk about degeneration and regeneration of the nerve. Okay, so we'll start with neuromuscular physiology, and first we'll start with the nerve. So when we are talking about the nerve is a structural and functional unit of the nervous system. So almost brain, only the brain is contain almost trillions of the neurons, And all these neurons are interrelated to each other, and there's a variety of size, shape, and there are different functions. And it is one of the most complex type of the cell present in our body, and it has a very unique features that it is the body itself. Then it has two different type of processes: the dendrites and axon. So functionally or anatomically also, you can divide the neuron into body, dendrites, and axons. When we are talking about the now is not contain neurons. Now contain only axon. So whenever we are talking about only now, then it is only axon, which is contain the now, while a body is present somewhere else, and that is usually present in the either in the central nervous system, that is in the brain or spinal cord, or into the ganglion which present outside the central nervous system. Ganglion is the group of the body of the neurons which present outside the central nervous system. Okay, those are called the ganglia. So these are the body, and these are actually control mechanism which control the function of the both dendrites and axons. That is also called as a referred as a soma, or also called as a carry-on. So peri means surrounding, carry means nucleus. So nucleus के surrounding का जो structure है, that. So we also call it as a soma. So this portion is from soma of the neuron or body of the neuron, and which contain almost all structure which present in any other cell. So it contain nucleus, it contain mitochondria, it contain endoplasmic reticulum, rough endoplasmic reticulum, smooth endoplasmic reticulum, Golgi apparatus, and apart from that, it contains various granules called Nissel's bodies, and it contains cytoplasm, and that is called neuroplasm. The cytoplasm is present in the body, and it is surrounded by the cell membrane. And this has a varieties of shape. This body has a different shape. It can be like a star shape. From that name is developed like astrocytes or something like that. Then it contain a maybe circular round shape also will be there, maybe in pyramidal shape, or maybe in the fusiform or dumbbell-like shape. So there are very different type of the shells. And nucleus is a large nucleus which is present in the center portion of the body, and which contain two nucleus, but with a less chromatic material. Then come to the different structure which present inside this body. So one is the cytoplasm which present, and the cytoplasm contain small granules, and those granules are referred as a nacelles granules or nacelles bodies. These are basophilic in structure, so they stain with a bluish color. So they look bluish when we stain and we see under microscope. And there are nothing but the fragments of rough endoplasmic reticulum. And because of this, the rough endoplasmic reticulum, they had a high ability to synthesize the protein. So they synthesize the protein in these nacelle granules. And these protein are usually nothing but the neurotransmitters and sometimes some other enzymes which is important for the maintaining the functions and repair of the neurons. But this Nissil granules doesn't present in an axon or axon hillock, which is a just portion comes before the axon or dendrite. So they doesn't present. They present only in the बॉडी सो जो साइटोप्लाज्म जो सोमा में होता है उसी में दिस नेसल ग्रैन्यूल्स होते हैं and whenever there occur any injury to the cell, even if it occur injury to the axon or some other dendrite or other part, or whenever the cell exposed to the poison, or whenever cell is overstimulated and got fatigue, the amount of the nasal granules start reducing, and this is called disintegration of the cell, or it is also called as a chromatolysis. So that bluish coloration, chroma means color. So that color is removing from the cytoplasm. That's why name is good, chromatolysis. So that will keep on disintegrating. Nasal granule is the one which disappear from the cell whenever there is injury occur to the cell. Then there is another structure which present is neurofibrils. These are microfilaments and macrotubules which present in the cell, and these are important for maintaining the size and shape of the cell. And these are usually affected in degenerative diseases like Alzheimer's disease, and this will start disintegrating in this Alzheimer's disease and will form small fragments-like structure in the soma, and that is called neurofibrillary triangles. आप ये बीच बीच में हैंड रेस क्यों करते रहते हो? ये बताने के लिए कि मैं ऐसे जगा हुआ हूँ। Okay, now apart from this, this also contains the granules which contain pigments, and this is like when they contain black color pigment, they are called neuromelanin, which gives blackish color or grayish color to the neurons. Sorry. And this type of the neurons present in a specific nucleus of the basal ganglia, that is substantia nigra. Some other neurons also contain pigment, which is made up of the lipid, and that these pigments are called lipofuscins. कौन सा फिफ्थ पॉइंट है? पहला, दूसरा, तीसरा, चौथा, पांचवा. Okay, whenever there is injury occur to the cell, even if injury occur to the axon or any part of the cell, the first change which appear in the soma is that cell's body will start disintegrating or they start degenerating. So they start disappearing from the cytoplasm. And this mechanism is called chromatolysis. Chroma means color. तो कलर निकल रहा है साइटोप्लाज्म से. now cytoplasm will become more clear. Now it will not look turbid because of presence of granules. जो turbid लिख रहा था अभी वो नहीं लिखता. That's why it's called chromatolysis. So that is what chromatolysis mechanism is there, and this is the first sign which shows whether there is injury occur to the cell. Then come to the dendrites. Dendrites are the small processes which present close to the bodies. There are multiple small processes are usually present. I'm talking about common. And this dendrite also contain the nasal bodies and neurofibers, and they are usually receptive functions. So they receive the signals. Substantia nigra is a part of the nucleus which present in basal ganglia. जब हम CNS पढ़ेंगे, that time we'll teach you detail about the basal ganglia. So basal ganglia is made up of different nucleus: caudate nucleus, putamen nucleus, subthalamic nucleus, and substantia nigra. Okay, so this is one of the part of that nucleus which contain neurons, which has a pigment called neuromelanin. Nigra means black color. So because of the neuromelanin, melanin is also called because of black color. Because of presence of neuromelanin, these neurons looks more dark in color. That's why name is given substantia nigra. Okay, it receives the signals from the different part of the neurons, accumulate the signal through the neurons, and send this information to the soma. So अलग-अलग तरीके से all these processes will synapse with the different axons, and they receive the information and then it sends to the body. The body will analyze the signals, modify, and depend upon the what of the signals are coming, it will start react, and then it sends signal to the outgoing process, that is axon. So axon, normally it is only one single long process present in the nerve cell, which arises from the conical extension of the cell body, and that called axon iliac. So this is just initial portion of the cell is called axon iliac, and this usually doesn't contain any nasal body. The typical feature of this axon iliac is that it contains very high number of voltage gated sodium channels on its cell membrane. So यहाँ के जो सेल मेम्ब्रेन होते हैं यहाँ पे voltage gated sodium channels बहुत high concentration होता है. And so whenever the firing level goes, it opens almost these voltage gated sodium channels there, and large amount of the sodium channels will enter into that axon iliac and can cause action potential. So action potential never occur in dendrites, it never occur in the soma, it always occur in axon iliac. Okay, So this is how why axon hillock is a site where the initiation of the action potential occur. It is because of high number of voltage gated sodium channels. And the cytoplasm which present in the axon are usually referred as a axoplasm, and cell membrane of the axon is referred as a axolemma. So once they move through away from the body, and once they reach to their definite site, at the end, these axons will divide into multiple small processes. So there are hundreds of small processes will divide, and each process will end with a small dilatation. And that dilated portion is called synaptic knob. And this synaptic knob synapses with the other dendrites, other soma, or other axon, and makes synapses with the other axon and send the signal from this neuron to the other neurons. So that is a function of synaptic knob. And the dilated portion of the synaptic knob contain large number of the mitochondria and also contain the vesicles which are rich in the neurotransmitter. So whenever the action potential generate, the synaptic knob release those neurotransmitter there, and this neurotransmitter goes act on a postsynaptic membrane, which can be either because of dendrites, or it can be either of the soma, or it can be either of the another axon, and then transmit the signal to the postsynaptic membrane. Then, whenever you're talking about axon, the one word is keep on repeating, that is myelinated nerves and non-myelinated nerve. That is related to myelin sheath. Okay, so axon which covered with the myelin sheath are called myelinated nerves, and axon which doesn't cover with the myelin sheath are called non-myelinated nerve. So myelin sheath is usually made up of Schwann cell, and the process of generation of the myelin sheath of the uh, nerve fiber is called myelination of the nerve fiber. And myelination of the various neurons is still continue even after uh, birth. जब तक birth होते तब तक almost all brain is completely developed. Brain is completely developed, but many portion of the brain is not myelinated. So myelination will continue even after birth, and it will continue for up to 2 years of the age. The myelination will be continuously going on, and it is like formation of the myelin sheath surrounding the nerve fibers. Now, how this myelin sheath forms? Suppose this is a axon, and this will form by the uh, Schwann cell, and Schwann cell will wrap this cell membrane firmly surrounding the hundreds times along the axon, and that they will firmly attach to each other with the anchoring protein. So it's like they stitch each other. So the anchoring protein, and they will form only a thick layer of the lipid bilayer, and that thick layer which doesn't contain air. If you see, it doesn't contain any cytoplasm. So that thick layer of this lipid bilayer of the myelin sheath will be formed against the axon, and only upper portion of this myelin sheath will contain small number of the cytoplasm and nucleus. Okay, so this is how this myelin sheath will be formed, and it is ranges from it goes start with, and it has length somewhere around 1 mm distance it will long, and then there is gap between two myelin sheath. So one myelin sheath formed by the one Schwann cell, and there is a gap between these two myelin sheath, and that is somewhere around 1 micron gap, and that gap is called as a node of Ranvier. So gap which present, that is node of the Ranvier. Now, what this myelin sheath does, it doesn't allow this axon to come in contact with the extracellular fluid. So only portion of the axon which come in contact of the extracellular fluid is the portion which present in the node of Ranvier. And this is the only portion where the exchange of the sodium, potassium ions or calcium ion occur. This is the only portion where it can make the changes in the membrane potential, because to change the membrane potential there has to be two terminals, interior and exterior. Here interior to hai yahan pe, but exterior pe myelin sheath hai. So the myelin sheath is uh, a resistance to the nerve conduction or any electric conduction because of presence of lipid bilayer. So it is like electric wire ko plastic ki coating de hoti hai. It is similar like that, the plastic coating occurring on the electric wire, insulating coating occurring on the axon is similar like that. So only the node of Ranvier will expose to the extracellular fluid, and because of that, when action potential generate, so action potential occur only at the node of the Ranvier. So from one node of the Ranvier, action potential goes to next node of Ranvier, then goes to the next node of Ranvier, and that increases the speed of conduction of the impulse. So that is one of the important feature of the myelin sheath. It increases the speed of conduction of the impulse through the axon by presence of the myelin sheath. Second thing, it increases the thickness of the axon, and that also because of increase in the thickness, it reduces the resistance to the nerve conduction, and because of that reduction to nerve conduction, that will also increase the speed of the conduction of the axon. Apart from this, it also perform as a insulating function. So insulating function की वजह से it will prevent the spillage of the impulse from one axon to the surrounding axon. So short circuiting बोलते हैं ना, that also prevented by this axon. So it doesn't allow to spread. So एक जगह पे axon होगा and it will keep on spreading impulse to surrounding tissue. That doesn't occur because of presence of myelin sheath. Apart from this myelin sheath will provide a pathway or skeleton for the regeneration of the injured nerve. Suppose axon injured हो चुका है, it will has been degenerated completely. If there is a myelin sheath available, then there is a possibility that axon can regenerate. If injury is not severe enough, then it can regenerate, and it will regenerate through this myelin skeleton. Myelin sheath will remain there as a ghost tube, and in that ghost tube only it will keep on regenerating. So regeneration is possible only in myelinated nerve. If nerve is unmyelinated, then there is no ghost tube available, and the regeneration is not possible in unmyelinated nerve. So myelin sheath also promote the regeneration. Then, then there are different type of the neurons we can classify and depend upon the number of the poles. So if there is only one process is coming, like it is here, only then it forms two different processes. One is dendrite and another is axon. And these are called unipolar neurons. And this type of unipolar neuron we usually see only in embryonic stages. As we progresses, then in post-embryonic stages, we don't find this type of the unipolar neuron. But we do find another type of the unipolar neuron, that is pseudo-unipolar. Here, now though it shows one process, but it is a two process. One process is axon, one process is a dendrite, and this is usually seen in the sensory neurons. So pseudo in sensory ganglion, whatever the neurons are present, these are a good example of pseudo-unipolar neurons. Then second type of the neuron is usually a bipolar neuron, where there's one axon, one dendrite and one axon will be there. So only there are two processes. One is dendrite and one is the axon. And this type of the bipolar neurons we'll see usually in the retina, or also in the olfactory epithelium also we see, and also in a vestibulocochlear ganglions also we see these type of the neurons, where only one dendrite and one axon will be there. Then come to the multipolar neurons, where multiple dendrites and one axon will be there. So there is called multipolar neurons, and these are most common type of the neurons which present in the central nervous system. Now, depending upon the functions, these neurons can be divided into motor neuron or sensory neurons. Motor neuron which carries the impulses from the central nervous system to the periphery. ग्लायल सेल पे आते हैं, आगे ग्लायल सेल है, तब उसके बारे में बात करेंगे. This motor neuron which carries impulses from the central nervous system and sends to the different part of the body, that is motor neuron. While sensory neuron is opposite direction, it receives the signals from the different part of the body, goes to the central nervous system. Then there are neurons also divided into different zones. So there is a receptor zone, site of impulse, site of origin of the impulse zone, zone of all or none transmission, and zone of secretion of neurotransmitters. Now, Schwann cell present in both central nervous system and peripheral nervous system also. So, जो tracts होते हैं, pyramidal tracts, all those things, they are myelinated tracts. So, in that also Schwann cell present. Okay, now come to the receptor zones. These are usually zone which receives the signal from the different neurons, and the signal comes and form the signal in the receptor zone in the form of graded potentials. It can be either excitatory or it can be inhibitory, and then they is summated, and they in together they will form a resultant effect on a whole soma, and then the whole soma will analyze the information. Okay. Analyze the information, and then it will decide whether um, impulse has to be originated or not. If impulse has to be originated, then there will be another zone, that is axon hillock, which is a site of the origin. This axon hillock, where the action potential will be generated. And the action potential is generated, why? Because of presence of high number of sodium channels, voltage gated sodium channels. Similarly, action potential can be generated in a sensory neurons at the site of the receptors. Receptor itself is one of the neurons. From there, it will be generated. So, the opposite side, we can see the how the impulses will be generated. And then once the impulse is generated, then it will carry to the through the axon. So that is a axon of zone of all or none transmission. Either it will carry the impulse only action potential or not at all. So impulse अगर carry करना है तो there has to be action potential. Axon will never carry graded potential impulses. So it will carry only action potential impulses. So it is a zone of all or none transmission. Either it will carry all impulses or it will carry no impulses. Okay, and once that impulse goes to the synaptic knob, and that zone is called zone of secretion of neurotransmitter. And where once the action potential goes to the synaptic knob, it will release the neurotransmitter synaptic knob, and now impulse goes to the next receptor zones of the another neurons, and again that cycle will continue. And this is how the signal transmit from one neuron to other neuron, and then from other neuron, and they will execute their function. Then come to the neuroglial cells. So अभी किसी ने पूछा था कि what is the glial cells? So these are like a supporting cells which are present in the spinal cord, and they are almost like a 100 of the cells for each neuron. So जितने neurons है उससे 100 गुना neuroglial cells होते हैं अपने body में. So the different type of the neuroglial cells. So one is a example is a microglial cells. These are large ectodermal neuroglial cells, and they are like a star shape, having multiple branches which divided and extensively spread in the central nervous system, and these are called astrocytes. So this is an example of our astrocytes, which is subdivided. And then there are another type of the cell which has a very less number of the cell, and these are called oligodendrocytes. And these are examples of some very, very less number of the processes are there. This is oligodendrocytes. Then there is another type of cell. These are a small size, and these are called microglial cells. And these are usually mesodermal in the origins, and they are usually present with the close to the body of the cells, and there are hundreds of these small neuroglial cells present throughout the central nervous system, and they are usually act like a macrophage of the central nervous system, the microglial cells. So whenever there is any injury occurs, they will remove the injured tissue from that part and fill that part, or remove that part and promote the healing of that part. So this is what a main function of this macroglial cell. Okay, then come to the nerve proper. These nerves are nothing but the group of the axons, and this is usually part of peripheral nervous system. So now is a bundle of axons which comes outside the central nervous system, is usually called as a nerve. And they usually arrange themselves in that small bundles, and these small bundles are called fasciculars. So now how this fascicle forms? Each axon is surrounded by the Schwann cells, and these Schwann cells attach to each other, anchor to each other, and forms a group of the nerve fibers. And there's a Schwann cell also surrounded by the endoneurium, the another fibrous tissue, and these fibrous tissues stitch each other to form the group of the nerve fibers that is called fasciculus. This whole fasciculus is surrounded by the another fibrous tissue, and this is much tougher than the endoneurium. Endoneurium is more elastic, this perineurium is much tougher and it will hold these fasciculus together. And these perineurium will stitch each other with a different perineurium along with the uh, uh, um, viscous or collagen fibers which surrounded these different fasciculus, and hold these collagen fibers and multiple fasciculus will come together and surrounded by the another much tougher fibrous tissue, and that is epineurium. The function of this endoneurium, perineurium, and epineurium, it prevents the overstretching of the neurons. Neurons are very fragile and they can easily get damaged. So, because of presence of the endoneurium, collagen fibers, perineurium, and epineurium, it will prevent the overstretching of the neurons. It prevents the injury to the neuron by the pressure, so they provide some pressure resistance, and it gives a limit to tensile strength to the neuron and prevent any damage or any injury to the neuron. So that is main function of these are epineurium and perineurium. This is how the nerve structure will be there. Then one of the important function of the this nerve is to carry the impulses. Apart from the impulses, this axon also carries the substances. It carries the substances from the body to the synaptic terminal or synaptic nerves, and also from the synaptic nerve to the what is the orange part? This portion, na, these portion are collagen tissues. They also bundle each other, and that gives a much tougher firmness to the nerve. Then come to the exoplasmic transport. Substances apart from the signal transmission. Yeah, connective tissue. Apart from the transmission of the signal, these also transmit the substances through the exoplasmic transport. So substances can go from the body to the synaptic nerve, or from the synaptic nerves to the body. So the both direction will be there, and depend upon the speed of the transport, it divided into two type of the transport, that is rapid transport and slow transport. So rapid transport is usually in the bidirectional. So it's somewhere around rapid transport. It goes when it moves from the body to the axon. It will go somewhere around 100 to 400 nanometer per day, and it is usually occur through the microtubules which are present in the axon, through which these substances goes, and the opposite will be there, that is from the uh, body axon towards the body, that is called retrograde transport, that also occur through the rapid mechanism, but it is much slower, not like that 100 or 400 millimeter per day, but it will carry somewhere around 10 to 20 millimeter per day in retrograde type of the transport. Then another transport is a slow transport, where it carries the substances only from 0.1 to 2 millimeter per day, and this is usually only in unidirectional. It goes from the body to the mm, exoplasm, and the substances which carries are like a neurofilaments or tubulins or soluble enzymes from or protein subunits from the body to the synaptic terminals. Now, because of this transport mechanism, it maintain the functioning of the axon, and repairing of the axon will be occur because of the water synthesis occur in the soma. It will transmit it, and it will supply with the new organelles like mitochondria, and all those things also moves from this, and it goes keep on going to the axon terminals, and try to maintain or repair the axon water damage and small injuries occur. And retrograde transmission, it usually carries the various substances which can be absorbed by the axon terminal, specifically like a viral infection. Virus can go from the axon terminal go to central nervous system, or toxins from the axon terminal to the go to the central nervous system. Like virus, like a rabies virus, which you had a bite somewhere around the hand, and through the axon it goes to the central nervous system and affect our central nervous system. Similarly, toxins like tetanus toxin, which is Clostridium tetani, has an infection somewhere, hand injury occur here, and that tetanus, Clostridium tetani growing here and release those toxins. That toxin goes and transfer to the axon and will affect our central nervous system. So these are the clinical significance of axoplasmic transport mechanism. Then come to the electrical properties of the nerves. So one of the important electrical properties, excitability. So now our neurons are the one of the highly excitable cell present in our body. So they already has their memory potential, as the resting memory potential has a little higher level, somewhere minus 70 millivolt, and from there it is very easy to go up to the minus 55 millivolt. So they can easily, so the threshold of the stimulus is very low, and that can generate initiate the excitation in the tissue. And whenever the neurons get excited, it will generate action potential. Apart from this excitability, it has also high ability to carry that stimulation or electrical impulses from one part of the nerve to the entire length of the nerve fiber. That property is called conductivity. So first we'll talk about the excitability. So resting memory potential we already studied. I guess I already teach you action potential also, but again we'll revise here. So action potential is defined as a spontaneous non-decremental change in the membrane potential when it is stimulated by the threshold stimulus. So spontaneous is obviously very important. So here brief that refers to the spontaneous, and sequence means non-decremental continuous changes occur. That is what how we can define the action potential. So whenever action potential is generated, it generated in a different phases in the change in the resting memory potential. So memory potential. So start with resting memory potential when there is no stimulus is applied. Then it start once the stimulus is applied. So time taken for the resting memory potential goes up to the firing level, that is latent period. Once the firing level started, then from firing level it goes to the overshoot, that is depolarization phase. And then when our memory potential goes above zero, that is called spike potential. Then from spike potential it goes down, that is called repolarization. And when memory potential goes below resting memory potential, then we call it as a hyperpolarization. So these are different phases. So A is one of the which is seen only in experiments. So that is a stimulus artifact. So this is a stimulus artifact, and that also indicate the timing of the stimulus. So time from this A point to this point is a latent period. From this point to the B is a generation of the firing level, and from here it is a depolarization phase. So this comes under like overshoot, and this is part is a spike potential, and then this is a repolarization, and this E phase is a depolarization. Okay, so sorry, hyperpolarization. So these are the different phases of the action potential. As I said, resting memory potential, we already described there are various factors which are responsible for the resting memory potential, like unequal distribution of the ions across the membrane, then presence of the anion within the cell, then Gibbs-Donner effect, uh, Nern's equation, then Hodgkin's modified equation, and also role of the sodium potassium ATPase. We already discussed about the resting memory potential, and because of this, the memory potential generated or present on the nerve is somewhere around minus 70 millivolt. Once you stimulate, you apply the electric current or stimulation to the nerve, that will causes a spillage of the current, and that will affect uh, the recording that is called I forget, cathode ray galvanometers. So that shows the diffraction in the cathode ray galvanometer, and that is a stimulus artifact. And the stimulus artifact will give you idea about the timing of the stimulus. So हमने उस समय उसको stimulus दिया, and then there is a pause. There is no change occur in the memory potential for some fraction of second after application of the stimulus. So the gap between the application of the stimulus and change in the memory potential, the total period is called latent period. And latent period is occur because of there might be we are applying the stimulus is a little bit away from the site of the stimulus, and recording electrode is away from the stimulus. So there is a gap between that. So time taken to travel the stimulus from the uh, st- uh, stimulated electrode till the recording electrode, it will take little bit time. Apart from this, it also depend upon the conduction velocity and time to take to generate the action potential. So for that also it will take little bit time, and this both will contribute in latent period. Then come to the firing level. Once the stimulus is given strong enough, they will open a sodium channels, and sodium ion will start entering inside the cell, and that will raise the membrane potential. So minus 70, it can goes up to minus 65. Then from minus 65, if strong stimulus gives, it can open more sodium channels, can goes to minus 60. If you go more stronger, it can goes up to minus 54. Once it reaches to the minus 54, this is a critical membrane potential level where voltage gated sodium channels are sensitive, and it will open the voltage gated sodium channels, and up to that level is called firing level, and then it will cause over increase in the memory potential, that is called overshoot. Of this phase is called depolarization phase, and that can goes above the zero, and it can goes up to minus 30 to plus 32 plus 40 millivolt, and that phase is called spike potential. From there the memory potential goes down, so uh, start decreasing, and that is called repolarization phase. So it forms a spike like a pointed upward portion, and that is called spike potential. And repolarization occur, it will slowly start coming towards the minus 70 millivolt memory potential, but slowly it goes beyond that, and it goes much lower, that's somewhere around minus 72 millivolt, and this is called hyperpolarization. Now how these all effects occur, and what is the reason behind how these effects occur, and that is called ionic basis of action potential. So ionic resting memory potential is because of the unequal distribution of the ions. That unequal distribution is there is a high concentration of the sodium ion outside the cell. So consider this is a neuron, and there is a this is extracellular fluid, and here the sodium concentration is very much high. Okay. Similarly, there is a much higher concentration. This is intracellular fluid of the neuron, and here potassium concentration is much higher. Remember this, सोडियम concentration बाहर ज़्यादा होता है और potassium concentration अंदर ज़्यादा होता है. So this is actually occurring in the resting membrane potential. Now once you apply the stimulus, that will stimulate the receptor. Stimulus might be any type of the stimulus. Here we are using electrical stimulus, but we can use a simple stretch stimulus, thermostimulus, chemical stimulus, and all the stimulus will have one type of the effect, and it will increase the permeability of the membrane for the sodium ions. So again, membrane sodium ion के लिए permeability होगी, तो sodium कहाँ जाएगा? Where it will move? It will move from high concentration to low concentration, and sodium will start entering inside the membrane. Sodium is positive charge, so positive ions entering into the cell, and that will increase the membrane potential. From minus 70 it goes to minus 65, minus 65, 60. Stimulus ज़्यादा होगा था, and if stimulus is strong enough, it can goes up to even minus 55 millivolt. Once the sodium memory potential reach to the minus 55 millivolt, they open a specialized voltage gated sodium channels. These are also called as AM gate channels. These voltage gated sodium channels, they are present in the neurons, and they are very rapid in action, and once they reach to the minus 55 millivolt, almost all voltage gated sodium channels open, and that will cause a severe increase in the permeability of the cell membrane. So there is a huge door open for the sodium ion, and as you know, sodium ion concentration is much higher outside and inside. So now at a much higher speed, sodium ions enter inside the cell, and that is called causes rapid rise in the membrane potential. Okay, and it will start keep on increasing and goes up to action potential, and it can goes even up to above the 0 and go to plus 30 or sometimes plus 40 also. Now once it start going outside, there is a limit why it goes up to only plus 30 or plus 40, and that is called a limit for the depolarization. That limit occur because of sodium channels will remain active for only for fraction of second, and they once they become active, they automatically on its own become inactivated. They doesn't require any change in the memory position. Once you stimulate it, after that they will become inactive after fraction of second. And once they active and they immediately get inactive. Now there's no more sodium channels available to enter. So there's no positive ions are entering. So that is the one factor which limit the depolarization phase. So plus 60, plus 70, plus 80 tak nahi jata. It goes somewhere plus 30 to plus 40. Second thing, when they become overshoot, inside will become positive charge and outside will become negative. And that positive charge will repel the sodium ion. So that will prevent the little bit entry of the sodium ion inside the cell. And that is how the little bit less entry once they reached at above the plus ion because of reversal of the electric gradient. That prevents a little bit, not much, because of concentration gradient is still high. So it's still entering only. It is not like the reversal हो गया electrical gradient तो होगा नहीं, but speed of entry will be little bit low. Second thing, then third thing, once the memory potential goes above the minus 30 or minus 20, it will open the another channel that is voltage gated sodium potassium channels. And now the voltage gated potassium channel is very slow to open. So though it start opening at a minus 20 millivolt, but it will completely become active once it reaches above the 0. Now potassium channels are also open. Now as if you know the potassium channels, potassium ion concentration is much higher inside as compared to outside. As it increases the permeability of the potassium ion, now potassium ion start moving outside the neurons. And since the positive ions are moving outside, that will reduce the positivity inside the cell, and that's why how it will limit the membrane potential. Not only limit, now it will reverse the potential. Now it's raising the potential going plus. Now it start decreasing the potential. Now because of the no influx of the sodium ion, but increased influx of the potassium ions through the voltage gated potassium channel. The potassium ion will keep on moving outside the cell. So potassium ion will keep on moving at a very high speed, and that will now start decreasing as the positive ions were losing from the cell. And because of the losing of the positive ions, the memory potential will slowly start decreasing. It will try to come towards the resting membrane potential. This phase is called repolarization. Now, once they go below minus 40, this potassium channel start closing. Once it goes minus 40, the potassium channel start closing, but they're very slow to close. So even if after minus 70 they reach, they'll keep on reaching and goes below minus 70, and they'll memory potential sometimes reach up to minus 72 millivolt. And this phase is called after hyperpolarization. No, this doesn't work like sodium potassium pump. Sodium potassium pump has opposite effect. यहाँ पे सोडियम अंदर जा रहा, पोटेशियम बाहर जा रहा. सोडियम पोटेशियम पंप में सोडियम बाहर जाता है, पोटेशियम अंदर आता है. These both sodium channel, voltage gated sodium channel, voltage gated potassium channel are example of facilitated diffusion, while sodium potassium pump is example of active transport, primary active transport. So understand this difference. Okay. So this is how the action potential generate, and this impulse will transmit from the one signal to the other signal. Now, to understand the various characteristics of excitability, to see the excitability, we perform one experiment, and that experiment is called strength duration curve. Here, we'll compare the relationship between the strength of the stimulus and time taken to initiate the or to excite the any tissue or initiate or generate the action potential in particular tissue or to initiate the response in particular tissue. सो हम स्ट्रेंथ बढ़ाएंगे और बहुत टाइम तक लगाते रहेंगे. सो वी स्टार्ट अप्लाइंग current strength from very low stimulus, and we'll keep on giving, and we'll keep on stimulating, and we'll see whether the nerve is responding or not. If the nerve is not responding, then we'll keep on increasing the strength of the stimulus slowly, slowly. At one point will come when we'll apply it for enough time, it will generate the action potential in that particular tissue. So this is what a tissue stimulus here somewhere. Suppose this is current in millivolt. It is somewhere around considered 13 millivolt. This is not exact 13 volt. This is not exact. 30 volt का हम जब current लगा रहे हैं, then he will able to generate action potential in the particular nerve by the time of 10 millisecond. Okay, so this is what first experiment will do, and here the threshold stimulus is referred as a Rio base. So how we can define a Rio base? Minimum intensity of the stimulus when it applied for the adequate time which could able to produce response is called Rio base. So this is what a Rio base, and the time required to initiate the response or produce the response is called utilization time. Now what we will do, we will have double the strength of the stimulus than the Rio base. अभी Rio base 13 volt का था. Now here we will apply with the 26 volt, and now we'll see how much time it will take to generate the response in the or to produce the response into the tissue. So here it will take somewhere around just a little bit more than 0.01 second. And now the time which required to generate a response when we apply double the Rheobase stimulus, that time is called chronexy. And chronexy will give you exact idea about the excitability of the tissue. Smaller the chronexy, greater the excitability. Greater the chronexy, less is the excitability. Now here if you see there are two curves has been plotted, curve A and curve B. The curve A is a curve of the neuron or nerve, while curve B is a curve of the muscle, skeletal muscle. And you can see the difference between the chronexy of the skeletal muscle and chronexy of the neuron. And neuron is much, much excitable as compared to muscle. So this is just a strength duration curve. Sometimes you get example, you might see this type of diagram and what is the value of the C, or what does mean of the C, or what does mean of the R. All those things, a question can be asked to you. The another characteristics is all or none response. So action potential is the one which follow the property of all or none response. It is like a small kid. मुझे चाहिए तो पूरी चॉकलेट चाहिए, नहीं तो कुछ नहीं चाहिए. Similarly, they will respond, then they will respond with their maximum effect. So जब एक्शन पोटेंशियल आएगा तो उसका मैक्सिमम +30 +40 जो होगा उसी लेवल तक उसका जाएगा, स्टिमुलस जाएगा, or they will not respond at all. So when you apply the subthreshold stimulus, there will be just little bit artifacts, but there will be no action potential will be generated. But once you stimulate the threshold stimulus, action potential will generate, and that will generate with its maximum strength. अब उस threshold stimulus का आप double threshold stimulus लगा लो, triple threshold stimulus लगा लो, then also it will generate the action potential with same intensity. उसमें नहीं double होगा तो action potential ज़्यादा हो गया. No, it will generate with its maximum intensity. This mechanism is called all or none response. जो आपके साथ होता है. Either you will understand everything or you will understand nothing. That is what all or none response. थोड़ा बहुत आपके साथ कभी नहीं होता. Then okay, as भी time हो गया है. This topic, membrane excitability and all those things, we'll talk in the next class. Okay.